let us discuss about one more topic of cardiovascular system, that is shock. So in this presentation we are going to see the pathophysiology of shock. So what is shock actually? So shock is a condition where there will be cellular impairment, or else in the cardiovascular system, if the cells of that particular heart, or else if the cells of heart, that is myocytes, if there is any damage to that myocytes, then the cell perfusion won't be proper. So or else we can say there is any decreased cellular perfusion or cellular impairment, then this shock may occur. And the shock may occur because of the imbalance between the oxygen supply as well as oxygen demand and nutrients. So in for example, let us take the condition of angina. So in angina there will be decreased oxygen supply to the heart. So in this condition also the person may be prone to shock. What happens if shock occurs, or if there is any inadequate tissue perfusion? What happens? So cells in any part of the body, cells play a major important role. So whatever the drugs, nutrients, body fluids or molecules, they have to permeate through the cell only in order for them to enter the cell. For example, let us take nutrients. So nutrients have to permeate through the cell, then only once after entering into the cell they can show their action, and thereby a healthy individual can be observed. But here if there is any disturbance or any damage to the cellular perfusion, there won't be any absorption by the cell. If the cell don't absorb nutrients or water or drug molecule, then the patient may be prone to shock. And let us see what happens if the tissue perfusion is not proper. So here, if tissue perfusion is not proper, we can see the generalized cellular hypoxia. Cellular hypoxia in the sense the cellular damage, or is the lack of oxygen to the cells. If oxygen is lacked to the cells, then the cells will shrink, or else we can say the cellular damage may occur. And apart from that, there will be tissue damage. If cells get damaged, tissue will be damaged. Here we can see in the diagram, let us take heart attack. So in the heart attack, the arteries are blocked. If arteries are blocked or the arterial cells are impaired, then what happens? The perfusion won't take proper. So in this cardiovascular condition, there will be occurrence of shock. And once if tissue damage is occurred, once cells are damaged, tissue will be damaged. Once tissue is damaged, then that organ is damaged. If organ damage takes place, then it may lead to death of the person. So let us see the pathophysiology behind the shock. So usually aerobic metabolism takes place, or aerobic respiration takes place. So here in aerobic respiration or as aerobic metabolism, in that particular process it requires oxygen. But if there is any decrease in the oxygen supply or oxygen demand increases, then it shifts from aerobic respiration to anaerobic respiration or anaerobic metabolism. Anaerobic metabolism don't require energy, but here energy or oxygen. But here in anaerobic respiration, the pyruvates and lactic acid is formed, and when lactic acid gets accumulated in the body, there it becomes once it enters into the body, the cell functioning ceases. Once the cell functioning ceases, then the cell will swell. If the cell swells, then the permeation capacity of that cell increases. But in this kind of permeation, in anaerobic kind of permeation of the cells, the unwanted fluids will get entered into the cells, and thereby the swelling nature of the cell increases. And once it increases, the cellular hypoxia is seen, or else we can see the damage of the cell. Here we can see the flowchart of the pathophysiology. So once the cellular functioning ceases, or the membrane becomes more permeable, the electrolytes and fluids which are present inside and outside the body, the shifting of the cells, or we can say the shifting of the electrolytes from in and out of the cell takes place. So when more permeation occurs, the pump, that is proton and potassium pump which is present in the cells, will be damaged. If proton and potassium pump is damaged, then there occurs mitochondrial damage or mitochondrial cell death. Let us see the stages of shock. So there are various stages of shock. One is initial stage, compensatory stage, progressive stage, and irreversible or refractory stage. So how these stages are differentiated? So in initial stage, what happens? So when aerobic respiration is shifted to anaerobic respiration, then the cell becomes impaired. So this stage is reversible, and this stage can be reversed in by some of the new if the proper oxygen is given to that person, then this stage can be reversible. Second stage is compensatory stage. So what does this compensatory stage mean? So in this stage, the person or as the situation of first stage can be compensated. So here we are trying to get back the initial stage, we are trying to get back the cellular respiration or else the cellular function in a normal manner. The third stage is progressive stage. So from here the stages are irreversible. So here what happens, if the proper oxygen is not given to the cell or else the cell perfusion is not proper, the cell functioning is impaired, we can say the cellular damage occurred. Once the cellular damage occurred, tissue can also be seen. So this stage is reversible, and this occurs only when anaerobic respiration takes place. Last stage is irreversible or refractory stage. This is like worsening of the condition. When the tissue damage takes place, the complete organ won't function proper. So if the organ won't function proper, it leads to the death of the individual. Next stage is, let us see we have saw the pathophysiology of shock. So what happens because of the cellular shock? So if shock occurs, what is the consequence or what is the situation? So we can see the decreased myocardial contractibility. So myocardial tissue is a tissue which is present in the heart. Because of the contraction of this myocardial tissue only, heart will function proper. If decreased myocardial contraction takes place, then the myocardial tissue will be failed, or else we can say paralysis of that myocardial tissue occurs, and it leads to systemic lactic acidosis. So as it is a result of anaerobic respiration, anaerobic respiration forms pyruvates and lactic acids. So when this lactic acid gets accumulated in the cells, it leads to lactic acid acidosis. As it is an acid, the acidic environment increases in the cells, and it leads to decreased vascular tone. So the smooth muscle movements, the smooth muscle tone will be reduced. So especially in the heart muscle, that is in the vascular tissue, the tone of that vascular smooth muscle is decreased. And because of the decreased vascular smooth muscle tone, it leads to the decreased blood pressure as well as preload and cardiac output. So here once the smooth muscle, the movement of that smooth muscle in the heart decreased, then automatically the blood pressure is decreased. If blood pressure is decreased to normal stage, then that is fine. If blood pressure is decreased than the normal value, it leads to a condition called as hypotension. And apart from that, cardiac output is also decreased. The cardiac output is nothing but the stroke volume, or else we can say the amount of volume of heart, or else the capacity of the heart to pump a blood within a minute. So this will also be reduced. Here we can see the schematic representation of the pathophysiology. Here what happens is that because of the inadequate perfusion, there occurs cell hypoxia, or as cellular damage takes place. So in cellular hypoxia, if the cells lack oxygen, then there will be energy loss also to that particular cell. So once energy loss is occurred and thereby the accumulation of lactic acid takes place, then the acidic environment is created. Because of that, there occurs metabolic acidosis. Once the metabolic acidosis is occurred, then the proton as well as potassium pump which is present in the cells will be impaired. If that is impaired, then there will be decreased cell perfusion, and if there is decreased cell perfusion, there will be cellular impairment. Let us see the shock. We can say the generalized shock. So if the cells get impaired, we'll see there are categories of shock. Like if a shock is occurred, or else if a cellular perfusion is low in a particular region or for a particular organ, then that is called as for suppose let us say that if the cell perfusion is not proper in the cardiac region, then it's called as cardiogenic shock. But there are various other shocks, but here generalized shock, if a tissue is impaired or if an organ is impaired, what happens? So there are various types of shocks, but if this generalized shock is a shock which is happened because of any organ or any tissue. So what happens or what it results? So first thing is that it results in hypotension. There will be decreased blood pressure than its normal value. So normal blood pressure is about 120 mm of Hg and 90 mm of Hg. 120 by 80. That is 120 is systolic pressure and 80 is diastolic pressure. So if the hypotension or else if the diastolic pressure is below 80 degrees or 90 mm of Hg, then we call that condition as hypotension. And the MAP, that is myocardial arterial blood pressure. So this pressure, if it is less, mean arterial pressure or as mean arterial blood pressure, if it is less than 60 mm of Hg, then shock is caused. And tachycardia is a condition where there will be decreased force of contraction of heart, and that in that tachycardia condition also the shock is caused. And tachypnea, this tachypneic condition is a condition where there will be rapid breathing, or else there will be difficulty in breathing, or else there occurs sudden rapid breath. So in that condition also the shock is caused, and this rapid breathing occurs because of excessive carbon dioxide respiration. This generalized shock, what happens to the mental status of a person if generalized shock is occurred? If a person is suffering from this generalized shock, then there will be restlessness, there will be irritability for that person, and there will be some sort of confusion in that person, and there will be decreased urine output also. Let us see the classification of this shock. So this shock is classified into two categories. One is low blood flow and the other one is maldistribution of blood flow. So what is this low blood flow and maldistribution of blood flow? So as I told you, the shock has occurred because of the improper cellular permeability. So when the blood flow is not proper or the blood flow is not occurring in the cells, then or else we can say when the blood flow is low in the cells or blood permeability is low in the cells, then it leads to two types of shock again. One is cardiogenic shock and the other one is hypovolemic shock. And maldistribution of blood flow. So in this type of shocks, we can say there will be no blood flow at all, or else the blood permeability through the cells is nullified, and or else we can say there is no blood permeability in the cells. And this type of shock, the shock which come under this category is septic shock, anaphylactic shock and neurogenic shock. Let us see in detail about the shock. Cardiogenic shock. So what does this cardiogenic shock mean? If there is any impairment in the systolic as well as diastolic blood pressure, or if there is any decreased systolic or diastolic blood pressure, then this cardiogenic shock is occurred. And if because of this decreased systolic blood pressure, then there will be decreased cardiac output also. How does this happen? When the blood flow is not, or else we can say that when the blood flow is slow, or else the pressure with which the blood is flowing in the vascular tissue is low, then there will be the if this condition persists for longer period of time, we can say there occurs vascular paralysis. So when this stage is occurred, then the heart cannot pump out the blood. So in that condition there will be decreased cardiac output. Here we can say the pictorial representation, there occurs aortic stenosis. So this stenosis is occurred because of the narrowing of the blood pressure. Narrowing of the blood vessel. So, what are the causes of this cardiogenic shock? So, what might be the causes? There are various diseased conditions like myocardial infarction. Myocardial infarction is a condition where the cardiac myocyte or cardiac myogenic tissue is replaced with the fibrous tissue. So, when this cardiac tissue is replaced, then the cardiac tissue is impaired. And in cardiac myopathy condition and in blunt cardiac injury, if there is any injury to the cardiac tissue, apart from that, in pulmonary hypotension, cardiac hypotension, or we can say any cardiac related disorders, this cardiogenic shock can be occurred. Let us see the pathophysiology of this cardiogenic shock. Here is the schematic representation. Here, when systolic and diastolic blood pressure is not functioning properly, then there occurs decreased stroke volume. So cardiac output is related with the stroke volume. So when the stroke volume is decreased, then automatically cardiac output is decreased. If cardiac output is decreased, then there will be increased cell hypoxia, that is cellular damage. If cellular damage is increased, then there occurs impairment of the cell. And there is another pathway also where the cellular hypoxia occurs. For example, let us say that cardiac diastolic dysfunction when occurred. So when diastolic pressure is decreased in the pulmonary circulation, then there occurs pulmonary when there will be increased pulmonary pressure. So if that pressure increases, then there occurs pulmonary edema, that is the cells or the inflammation of the pulmonary vessels takes place. If that takes place, there will be decreased oxygen supply, and once decreased oxygen supply is there, it leads to increased cellular hypoxia and cellular impairment. Let us see how we can say that early manifestations. I mean, how can we take the care of this cardiogenic shock in the early stages only? First, if we observe the symptoms like tachycardia, hypotension, as well as narrowed pulse pressure and increased myocardial oxygen consumption. So if a person is having low blood pressure or tachycardia condition, first we have to take care that, or we have to go for the diagnosis of the shock. Once we go for the diagnosis of shock, if a person is there in the initial stage of shock, then we can cure that person, or we can cure the shock by using various drugs. So we have to take care, or we have to observe. If these symptoms are observed, then we have to give immediate treatment or care to that person. What are the physical examinations? How we can say if a person is suffering from cardiogenic shock by observing him physically. So one thing is that there will be a rapid breathing of that person or difficulty in the breathing, and there will be pulmonary congestion, that is the person will have difficulty in the breathing or he can't breathe properly, and there will be decreased capillary refill time. So this is done through physical, this is done through some test only, then only we can say whether the capillary refill time, that is the blood which is entering into the capillaries, the time by which the blood is entering into the capillaries. So that is determined, and we can say whether the person is suffering from cardiogenic shock or not. And apart from that, the person will be very anxiety in the confusion state in this particular cardiogenic shock. Let us see the next type of shock, that is hypovolemic shock. So what is this hypovolemic shock? So this is a condition where there will be loss of intravascular fluid, or else in the vascular blood vessels the fluid will be lost, or else the fluid will be moved out of that vascular tissue. So when does this hypovolemic shock occur? So this occurs when there is hemorrhagic conditions, and this occurs when there is GI disorders are there. If a person is suffering from diarrhea or is GI related disorders, and if a person have diabetes insipidus, frequent urination, hyperglycemia, as well as in diuresis condition. So in all these conditions there will be loss of fluids, and there will be loss of fluids in vascular system also. Then it leads to hypovolemic shock. So what is this relative hypovolemia? So the relative hypovolemia is a condition where there will be a relative, or else we can say a fluid loss to particular extent only, or else the fluid loss is limited to some extent only, and we can because of that, then there will be vascular space created. If fluid is lost, then the fluid is not replaced in that particular region very easily. So because of that, there will be a vascular space created, and that is called, in that condition is called as relative hypovolemia. Let us see the pathology of this relative hypovolemia. And this hypovolemia also we have two types, that is relative hypovolemia and absolute hypovolemia. So because of this loss of fluids in the vascular tissue, there will be decreased circulating volume, because once the fluid is lost, then fluid won't be replaced so easily. So because of that, the circulating volume or circulating blood will be decreased. If circulating blood is decreased, then the venous return will be decreased, or else the blood from the veins will be decreased, and because of that there will be decreased stroke volume and decreased cardiac output, and once the cardiac output is decreased, it leads to decreased cellular oxygen supply and tissue damage, and finally there will be impairment of the cellular region. Let us see the clinical manifestations. So if a person is having hypovolemic shock, what happens to that person? So he will be very anxiety, or he'll be in anxiety condition always, and there will be difficulty in breathing of that person, and apart from that there will be increased heart rate. The heart rate of the person will be high and the cardiac output of that person will be high, and in that condition there will be decreased stroke volume, and if the stroke volume is decreased, then there will be loss of blood, or as we can say the blood volume is decreased. Let us see the next type of shock, that is neurogenic shock. Till now the cardiogenic shock and hypovolemic shock, so these are the types of shock where there will be low blood flow. But here there will be maldistribution of blood flow, or else the blood distribution is not proper. And see, this neurogenic shock, the neurogenic shock is we can say the hemodynamic process or hemodynamic phenomena which occurs in the spinal cord, especially in the thoracic vertebra. In the T5 thoracic vertebra, if there is any impairment, or if there is any impairment in the functioning of the cells of the spinal cord, then this neurogenic shock is occurred, and this will be neurogenic shock can be occurred because of the action of spinal anesthesia. So if spinal anesthesia is given to that particular patient, and that spinal anesthesia action lasts for longer period of time, then there occurs the cellular impairment of the spinal region, and there may occur neurogenic shock, and it results, once the neurogenic shock occurred, it results to the vasodilation of that tissue. Let us see the pathophysiology of this neurogenic shock. So here we can see that once the spinal cord impairment takes place, then there occurs the disruption of sympathetic nervous system. So as I told you, nervous system has there will be central nervous system, peripheral nervous system, and autonomous nervous system. So in autonomous nervous system, we again have adrenergic nervous system and cholinergic nervous system, which is also called as sympathetic as well as parasympathetic nervous system. So in sympathetic nervous system, the innervations takes place from brain and spinal cord. So if there will be impairment in the sympathetic nervous system, then there will be the sympathetic nervous system shows effects like increased heart rate, increased cardiac output, increased muscular tone, and there will be increased we can say that increased renal functioning. So all these will be impaired because of that if there is any disturbance or a disruption of the sympathetic nervous system. So if let us see here that if sympathetic tone is lost, then venous and arterial vasodilation takes place. So here, as I told you, contraction of smooth muscle takes place because of the sympathetic nervous system activation. But here, if sympathetic nervous system disruption takes place, there will be dilation of the arteries or veins in the cardiac muscle. If that dilation takes place, there will be decreased blood pressure. If blood pressure is decreased, then there will be decreased venous return. If decreased venous return is observed, then there will be decreased stroke volume and cardiac output. Once the stroke volume and cardiac output is decreased, then there will be tissue hypoxia or cellular hypoxia leading to its impairment. And we saw the sympathetic pathway. The same time, if what happens if parasympathetic nervous system gets failed or disruption of parasympathetic nervous system takes place. So once the parasympathetic nervous system is disrupted, there will be decreased heart rate. Once the heart rate is decreased, then automatically cardiac output is decreased, and finally the result is the impairment of the cells. What are the clinical manifestations of this neurogenic shock. So once if a person is suffering from neurogenic shock, then there will be hypotension in that particular person, and there will be bradycardia, that is decreased force of contraction of the heart, and temperature dysregulation. The temperature will be fluctuated. The temperature conditions in the person will not be regulated, and there will be dry skin of that person, and it leads to picoliothermia. So this is a condition where there will be decreased temperature in the human system. Let us see the another type of shock, that is anaphylactic shock. So this anaphylactic shock also is a result of, or else we can say there will be maldistribution of blood flow. So what happens this or else why this anaphylactic shock is occurred? So this anaphylactic shock is occurred because of the acute hypersensitivity reactions. So these hypersensitivity reactions are the allergic type of reactions where their allergens are released in the body, and thereby we can see the rashes or various allergic reactions in that particular person. So if these allergic reactions worsen, then this anaphylactic shock can be observed, because once the allergens are released in more amount, then these because of these allergic reactions, the cellular permeability will be reduced, and because of this anaphylactic shock or else these hypersensitivity reactions, there occurs vasodilation, and because of the vasodilation there will be decreased blood pressure again. And apart from that, we can see the release of mediators. Mediators are nothing but chemical substances, or these are the allergens which are released. And apart from that, there will be increased capillary permeability. But if capillary permeability increases more, then the cell swells, and once the cell swells, the fluid will enter into the cells, and once the fluid enters, the pumps or else ion channels which are present in the cells will be damaged. What are the anaphylactic responses, or we can say what is the result of anaphylactic shock? So if a person is suffering from anaphylactic shock, it leads to vasodilation. So the blood vessels or else the dilation of the blood vessels takes place. And apart from that, bronchoconstriction takes place, because in shock condition or else in anaphylactic shock, there will be heavy breathing or rapid breathing of that person. So if rapid breathing occurs, it leads to bronchoconstriction condition, and it causes increased mucus production. So if mucus is secreted in the required amount, it acts as a protective layer. But if mucus is secreted in excessive amount, then it blocks that particular vessel, and mucus blockage will lead to increase or narrowing of that particular blood vessel, particular cell. And it may also causes a release of inflammatory mediators. So there are various inflammatory mediators which are released in the body. For example, we can say that histamine, bradykinin, substance P, these are few of the allergens which are released on response to the inflammatory reactions in the body. So when these increased inflammatory responses take place, increased allergens are released. If allergens are released more, hypersensitivity reaction takes place. If hypersensitivity reactions occurs, it leads to anaphylactic shock. What are the clinical manifestations if a person is having this anaphylactic shock? So how can we say that? The person will be anxiety always, the person will have severe confusion, he'll have severe dizziness, and there will be rashes all over the body. And apart from that, he'll have severe chest pain, because there will be decreased oxygen demand also, or else if there will be the constriction of that particular vessel because of the oversecretion of the mucus, then that will lead to cardiac failure, and because of that, if the oxygen demand decreases, and it leads to chest pain. And apart from that, there will be swelling of the lips and tongue of the person. Why? Because of heavy allergens which are released in the body. And once allergens are released in the body, it may also lead to flushing or rashes or various skin related disorders. The other type of shock is septic shock. So this is another type of maldistribution type of shock. So in septic shock, we can say three terminologies are important. One is sepsis, severe sepsis, and septic shock. So what is sepsis? So sepsis is a condition, or as we can say, it is a response to inflammatory reactions. So if there is any inflammation reaction occurring, then on to that inflammation reaction, the allergens are released in on response for that inflammation reactions. So that condition is called as sepsis, which leads to infection. And what is severe sepsis? So once if inflammatory reactions are more, because of these inflammatory reactions, there occurs organ dysfunction. And when this inflammatory reactions and organ dysfunction occurs, it leads to a condition called as severe sepsis. And once organ dysfunction takes place, there will be the impairment of that particular organ, and that may lead to the death of the person. So how this impairment is occurring? Once the organ is damaged, then there will be low permeability of cells in that particular tissue, and thereby it leads to septic shock. So in septic shock, the mortality rate is high. When compared to all other shocks, the cardiogenic shock as well as septic shock are very severe, because in cardiogenic shock, it directly acts on the cardiac muscle only, and if cardiac muscle gets impaired, it leads to heart failure. The same time, in septic shock also, it is inflammatory, it is we can say it is on result of this inflammatory reactions. So these inflammatory reactions occurs all over the body. If inflammatory reactions occurs all over the body, if organ dysfunction takes place all over the body, it leads to the death of that person. So that is the reason the mortality rate is very high. We can say it is almost up to 50% in this type of shock. And apart from that, this sepsis or else this septic shock is a result of the bacterial infection. There are gram-positive and gram-negative bacteria. So because of the infection which is caused by this gram-positive and gram-negative bacteria, then the septic shock can be occurred. And apart from that, the endotoxins or as the toxins which are released in the body on response of this inflammation reaction, then also the septic shock has occurred. What are the risk factors associated with this septic shock? Or as which group of people are prone to this septic shock? So one is age. On increase in age, the people are prone to this septic shock. And the other one is malnutrition. If we don't take diet or as if proper nutrition is not taken or not given to that person, then the various inflammatory reactions occurs, because if we take nutrition in a proper manner, then there will be no bacterial or protozoal or viral infections in our body. If there will be no infections, then there will be no inflammatory reactions. If no inflammatory reactions, then there will be no septic shock. So that is the reason malnutrition condition, the septic shock is observed. And in use of invasive catheters. So these catheters are the if we use catheters, invasive catheters are used because of the infection. If the catheters are not clean, or else if they are not if they are not cleaned well or cleansed well, or if they are not sterilized well, then because of the infection or bacteria which is present on the catheters, it may lead to the infection or bacterial infection or viral infection, and that may lead to sepsis shock. And drug therapy. The septic shock is a side effect of few drugs. So if we are giving any drug therapy, we have to make sure that it does not cause any inflammatory reactions in the body. Let us see the pathophysiology of this septic shock. Here we can see if the microorganisms are entering into the body, so our immune system will release antibodies against this microorganism, so that the antibodies will engulf those microorganisms and inflammatory response can be seen. So once the invading microorganisms, so because of that, there will be TNF, that is tumor necrosis factor, will be released, and interleukins will be released, and various other inflammatory mediators are released. So because of the inflammatory mediators are released, then there will be myocardial depression. And not only that, once the inflammatory mediators are released, it causes increased cellular membrane permeability. So once the cellular membrane permeability is increased, then there will be maldistribution of circulating blood flow. As I told you, once the unwanted cellular permeation takes place, then the cell stops functioning, or the cell functioning will be ceased. Because of that, there occurs low or no blood flow in that. Once the maldistribution of circulating blood takes place, there will be decreased oxygen supply, and once decreased oxygen supply is there, it leads to decreased cellular hypoxia. Let us see the clinical manifestations. So what are the clinical manifestations of the septic shock? So if a person is suffering from septic shock, then there will be increased coagulation. The more amount of coagulation occurs, or else the blood cell platelet count will be increased, and because of increased platelet count, there will be increased coagulation. And apart from that, there will be decreased fibrinolysis, or else we can say the formation of thrombin. Fibrinogen, or else fibrin, is an important component in the coagulation of the blood. Either there will be increased coagulation, or else there will be decreased coagulation. In high coagulation as well as decreased low coagulation also, it leads, in septic shock, there will be either high coagulation in few patients and there will be low coagulation in few patients. And apart from that, there will be difficulty in breathing of that person, and there will be temperature dysregulation, and there will be decreased urine output. The normal urine output is about 1 to 2 liters per day. But if a person is suffering from septic shock, then there will be decreased urine output, and there will be GI dysfunctioning also. So the gastrointestines will not, or else we can say the GI functioning will be impaired or improper. Let us see the mortality rate. As we told you, septic shock have high mortality rate. So in previous slide I have mentioned about 3 conditions: sepsis, severe sepsis and septic shock. So in sepsis condition, we can say that 7 to 17% of mortality rate. If a person is having sepsis condition, then 7 to 17% of mortality rate is observed. In severe sepsis, then the mortality rate is about 20 to 53%. As I told you, in septic shock, there will be high mortality rate. So in previous slides, I have told about 3 conditions, that is sepsis, severe sepsis and septic shock. So the mortality rate differs from the condition where the person is suffering from. If a person is having sepsis, that is initial stage of septic shock, then the mortality rate is almost 7 to 17%. If a person is having severe sepsis condition, then the mortality rate is almost 20 to 53%. But if a person is having septic shock, then the mortality rate is very high, that is almost 53 to 63%. So when compared to all of these shocks, septic shock and cardiogenic shock are very dangerous, or it may be fatal to the person.